Hello, I'm Sandra Fitzgerald and I'm one of the clinical editors with Health Pathways.
And I'm Jo Wood. I'm a GP and a clinical editor for Health Pathways. We're here to talk today about how Health Pathways has responded to the COVID-19 crisis and how it's going to be useful for general practitioners.
So Jo, how would you describe Health Pathways?
Well, it's a clinical tool for GPs and other people working in primary care that helps you to do an assessment of a patient, to manage them, and probably, arguably, one of the most important parts of it is to work out local referral pathways.
We liaise very closely with people in our local health district and local clinicians to make sure that we are taking national and state guidance and making it locally relevant for GPs and other primary care clinicians as well. Health Pathways have just introduced a whole new suite of pathways called COVID-19. The first one is practice preparation, and then we've got one that's around assessment and management, a whole page just on local referral information, an information page that's got lots of really useful links on it, and then still to come will be impact on local services, so how COVID-19 is affecting things like the outpatient clinics, the emergency departments, and inpatient services as well.
Yeah.
And there's one final other page there that's called recent changes, and on that page you will just find each day what we've changed on the pathway, so you don't have to go scouring through the whole pathway to see what's different from yesterday. We really rely on your feedback to let us know what's important for you in managing your patients. So if you can provide any succinct feedback that you have that will improve the pathway, on every page there's a little bubble that you can press to give that feedback. If you would like to get onto Health Pathways and you don't currently have access, just log on the URL on the screen and we will organise access for you. And probably the last thing we'd like to say is that this is really an unprecedented health event and we all need to just bind together and support each other, and that's one of the driving forces for our Health Pathways team is to do the best job we can to support all primary care clinicians. And so stay well, stay safe and look after yourselves and care for each other.